Hey everyone, it's Brandon, your colleague here on 6 Southeast. Thanks for your time and attention. I'm hoping by the end of this presentation, you'll have a little bit more confidence for assessing folks with darker skin tones. So before we begin, or we'll talk about kind of what the contents of this presentation are, indications for why we're talking about this at all, what are the evidence-based guidelines for assessing darker skin accurately, examples of some skin conditions on darker skin, resources we have at UW Medical Center, and kind of what we need to do as far as changes, potential future interventions, and then some resources. Okay, now before we begin, if y'all could just pull out your phones real quick and do this quick 30 to 60 second survey. You may need to use your UW login to access it. And just like raise your hand if you got any problems with it. I know y'all have been in education for a while. Y'all doing okay? Hanging in there? Okay, I'll give you just a few more seconds. Okay. Anyone still working on it? I think we're good. Okay, so let's talk about why we're talking about this at all. And so one of the reasons we need to address this is that darker skin assessment is a curricular blind spot, both in nursing education and in medical education, and there's no guidance here at UW Medical Center as well. For darker skin, assessment can be different. Irritation, inflammation, injury, and trauma may not be visible, obviously, and does not present with inflammatory or post-inflammatory redness. Rather can be hyperpigmentation, darkness, or purple. Scoring tools that use redness as a significant component result in underscoring of patients with darker skin. So that's stuff like the pressure staging, phlebitis staging, scoring for atopic dermatitis, eczema. And so clearly we're underrepresenting our darker skin patients in those. And then finally, because there's less early staging of pressure injuries for darker skin, there's a higher incidence of later stage pressure injuries in regardless of the setting, including ours, the inpatient. Okay, so let's talk about actually assessing the skin. So as we mentioned, redness may be absent. Instead, we can see hyperpigmentation, purple or maroon discoloration. When we assess folks with darker skin, we want to use non-fluorescent indirect lighting for accurate inspection. The reason being that we can see stuff like shininess, tautness, which could be a sign of edema or inflammation. bumpiness and scaliness, um, irritation, which could be a sign of irritation or inflammation. And then for skin that appears ashen or gray, um, we want to rehydrate that water to improve inspection, as folks with darker skin are actually more susceptible to sub-Q water loss than folks with lighter skin tones. Finally, it's important to compare like anatomically similar areas. So if we were looking at something that's going on with the arm on the right side, we want to compare with a similar spot on the left side, etc. So since visual details may not be so obvious, it's even more important to palpate skin for folks who have more pigment or melanin. Changes in temperature may indicate changes to the health of the skin. Coolness compared to adjacent skin or other anatomically similar areas could indicate necrosis, deep tissue injury, or later stage pressure injury. Warmth could indicate inflammation. We also want to check the surface and subsurface texture, stuff like induration or hardness, pitting edema, or bogginess. And then also we want to ask the patient for their subjective experience of like palpation. For example, they could be itching, they could be painful, and these are especially important to consider for folks with darker skin. So let's go over some examples. In this picture, you can see someone pressing on the skin of someone, and there's no visible change in skin color. What additional assessments might we utilize for this patient? So like stuff I just mentioned, we could check for texture. We can check for shininess, warmth compared to adjacent areas. So in these pictures, we see some erythema. The pictures on the top left picture is the same condition, just on folks of different skin tone. As you can see, the person with the lighter skin tone has some redness there, and the person with a darker skin tone does not. Since I can't really hear the audio from y'all super well, I'll just talk about some things that are different for these folks. I think one notable thing is the shininess that we observe for the person with darker skin, and that's a sign of swelling and erythema. And then also the textural differences we can see, like kind of the raised area, the bumpy area. And similarly for the picture on the right, we can see that there's some shininess. And it looks like there might be some swelling based on that. Okay. All right, so next up, this is a deep tissue pressure injury. Again, the coloration is not so obvious. And then what might we need to, I want y'all to think about what we might need to assess for this patient. And so I'd start with a higher suspicion of pressure injury or deep tissue injury. Using moisture because that skin looks a little ashy, to get a accurate sense of visual on the color. Palpating for pain, changes in temperature, probably cooler since they're having a deep tissue injury. Textural changes, like more softer underneath versus the other areas. Oops. Yeah, some things to consider that. And then here are some images of contact dermatitis. Again, these changes may not be obvious on visual assessment. For someone who has lighter skin tone, this might present as like a red patch all over their skin. Really important to ask, well, their symptoms. Since it's dermatitis, they're probably really itchy. So asking them about how they're feeling or if they've noticed any changes to their skin recently. Another thing that we could observe that we observe here is bumpiness. Not so obvious on the first one because it's a wider shot, but the picture on the third picture, you can see the second and the third picture, you can see some textural changes, which let us know that something might be different. Okay, so other considerations, vascular access sites like IVs, PICs, and other central lines, devices, tubes, and drains. We want to be especially vigilant to look out for these sites since there isn't redness, which we often rely on to tell us that there's phlebitis or something going on. Palpating for induration, asking about their sensation of pain, and maybe having a lower threshold for removing IVs or being extra vigilant to make sure that the chlorhexidine dries on PICs. Actually, one of the reasons that I was motivated to do this research was the patient we had in 38 who was there for a long time with us. They had darker skin, also was a bit confused, and they also had a PIC. And over time, they actually had their skin got worse. They got some bumpiness, some open like welts. And I'm hoping that this presentation kind of helps y'all feel more confident in identifying skin issues earlier. Other stuff like um, other skin issues with anemia and shock, you can have palmar and conjunctival pallor in folks with darker skin versus like cyanosis in folks who have lighter skin, which we would notice that with like a reduced darkness in the palmar creases. So like the lines in our palms or in their palms, I should say. And then in their conjunctiva, which is like the mucosa of the eyes or like eyelids. And then that would be like white or pale pink versus like a perfused healthy pink. Hopefully we don't get this or often on our unit, but if someone's having central cyanosis, also they present differently for folks with darker skin. It'd be most obvious in places where the epidermis is thin, non-pigmented, and highly vascular. So that would be like the oral mucosa, so like the gums. Maybe you'd see it in the lips, but more likely to see it like inside their mouth. And then another consideration is for folks who have more melanin, the way that O2 sat probes work, they see how much infrared light is coming through, but folks who have darker skin absorb more of that. And so we may actually, there are some studies done that show that folks with darker skin actually have a higher O2 perceived O2 saturation via the SAT probe than is in reality. And so with folks who have darker skin, we want to have be careful for if they have any respiratory issues, be monitoring it for any changes and having a lower threshold to escalate for them. Because their O2 sat, like let's say they're having some shortness of breath, but their saturation is fine. Maybe their saturation is not accurate. And so just being mindful of that. Let's see, other things, petechiae can be caused by trauma or clotting issues. Not really visible on folks with darker skin, but maybe observable in oral mucosa or conjunctiva. And then lastly, skin cancers are present for folks who have darker skin, but they may be present in areas without UV exposure. And so this might be like armpits or other places that don't see the sun, like your butt. Not like a huge inpatient issue, but something to inform folks so they can talk to their PCP if they have any changes in their skin, or if we see something, we can bring it up to the team for outpatient follow-up. Okay, so at UW, we don't actually have much as far as guidelines and resources for assessing darker skin accurately, but it's in the works. Colleen Carvonen, our wound and ostomy nurse specialist, They've incorporated some of these guidelines into like new hire nurse or skin presentation and the wound workshop, but they're still working on adding it to the pressure injury LMS. No current plans to update the policy, and then they're waiting for the assigned EPIC analyst to add terms needed specifically for folks with darker skin, such as hyperpigmented, ashy or ashen, puffy, boggy, tender, painful, rough, bumpy, etc. Okay, so potential future interventions might be implementing a pigment measurement scale to gather health data based on skin tone rather than race. As we know, race is not a scientific measure, it's a cultural label. So you can have like any skin tone and identify as Black, for example. And so in the future, we might might implement using like a Fitzpatrick classification scale, which is like a skin tone scale, and then, or the eumelanin human skin color scale, which is measured by light reflectance of skin based on how much melanin they have. And that could have uses in other research related to pigment in skin, such as the pulse oximetry we mentioned. That study is based on race, but might be more effective if it was based on skin tone. And then there's a new technology that exists. They haven't done resource studies to see if it's worth like buying stuff for, but it exists. And this subepidermal moisture can detect what it says, subepidermal moisture, which is an earlier sign of pressure injury. And it's like a scanner device. And so that's something that exists and may be implemented in the future. So here's some resources. Happy to send y'all the presentation if y'all would like to like take a peek at them. And here's the works cited. And lastly, if I could ask y'all to do the survey just once more. And in the meantime, please feel free to ask any questions. Thanks for your time.
Thanks, Brandon.